So patients with myelofibrosis have multiple treatment options now open in 2023. Although historically ruxolitinib, the JAK1/2 inhibitor, has been the mainstay of therapy, and it's been well described that patients who are treated with ruxolitinib can get thrombocytopenia, and we don't really have great ways of predicting which patients get thrombocytopenia and which patients do not. And before there was other JAK inhibitors available, that didn't really make much of a difference. But now that we have JAK inhibitors available that are safe and effective in patients with thrombocytopenia, it becomes even more important to try to understand which patients are more likely to get thrombocytopenia so you can tailor your initial JAK inhibitor use. So we performed a dual institution study with Mount Sinai and Moffitt Cancer Center and looking at around 300 patients with myelofibrosis treated with ruxolitinib and tried to understand what some of the predictors were of patients who developed a severe or moderate thrombocytopenia. And we specifically looked at patients who had a platelet count above 100,000 and then used an endpoint of patients who developed a platelet count less than 100,000 at either 3 months or 6 months. And that was done to really try to isolate patients who get thrombocytopenia because of the JAK inhibitor, not just because of the disease itself. We found that many patients did get this thrombocytopenia, although there weren't really great molecular or mutational predictors of this. What mostly predicts patients who get moderate or severe thrombocytopenia are patients who have lower baseline platelet counts. So your risk of getting moderate or severe thrombocytopenia is higher if your platelet count is between 100 and 150, and still high if it's between 150 and 200. But above 200, it starts to lose its significance. We're looking now in the future trying to understand even further groups of mutations like high molecular risk mutations or co-occurring mutations that may predict for those patients to try to understand which patients are going to get thrombocytopenia so that you can then a priori try to design your JAK inhibitor regimen.